One of the biggest things, especially kind of in the primary care world that we're in, that I think needs to change is this assumption that eating disorders are really rare. I think in med school, people learn, the real small prevalences of anorexia or bulimia nervosa, and they think this is not something that I'm going to see as a family med doc. And really, what we know is that I keep using the phrase disordered eating behaviors, and this sort of encompasses all of these behaviors that are disordered, but may not meet that threshold for a true clinical diagnosis. Or it may mean someone who's engaging in all of these behaviors, but just never makes it to a facility where they receive that clinical diagnosis. And we know that the prevalence of these behaviors is really high, actually, right? So when you're in primary care, when you're a dietitian, when you're behavioral health folks, if you're a family medicine doctor, like you are seeing patients who are engaged in disordered eating behaviors, probably daily, weekly in your clinic. And the behaviors kind of range across, they impact people of all races, all ages, all socioeconomic statuses. We've actually begun to learn a lot about the impact of food insecurity on the development of disordered eating. And so sort of dispelling the myth that these are rare or that they only impact a certain type of person, I think is one of the biggest changes that we need to see. Because once we begin to recognize, like, these are in my office, then we start to ask the questions about how can I be sure I know when my patients are facing them, what can I do to prevent, how can I screen, and when do I need to refer, right? And those are all the things that we need to be asking in primary care to make sure that we're doing right by our patients.